elevation. So I want to make sure that his we're not into any amount of frontal plane. We would want to put a hip or a pillow. Do you see how his knee is lower than his hip here? So we want to make sure that our thigh is parallel. So a towel roll or a pillow underneath the distal, scoot back a little bit, distal thigh to make sure that his thigh is parallel. And then I will take him into this motion. My landmarks are the same. Again, I'm looking for any compensation with pelvic lean, lateral tilt, abduction. And so here I will take I could take my measurement. Perpendicular to the floor, tibia, and patella. Now your measurements are going to be different, which is why it's important to do in the clinic prone and supine. Why are they different?
We go against gravity, getting down, or use more muscle.
So we're doing a passive test.
Flexion.
No, because either way my knee is flexed. But your hip, yeah.
And you have the rectus, you have more
So along the same line, if you have adequate rectus femoris length, that wouldn't necessarily be an issue. But we're putting it's depending on where your hip is in that sagittal plane, depends on which hip, which parts of the joint capsule and ligaments are tensed. So kind of like the shoulder. So the further you go into abduction, you're getting different components of either superior medial or inferior glenohumeral ligaments are under tension. So too much to know for this class. But there is a difference based on which parts of the hip joint capsule and ligamentous structure are being tense depending on where you're going. So you will see a difference prone and supine. Just keep that in mind. Okay. But close. Yeah. So along the same line of the
So which one do you
positioning.
prefer for the practical?
So you could do either.
Okay.
I want you guys to practice both. Okay.